Hi, I'm Dr. Jonathan Turkish, and I'm an obstetrician and gynecologist. I do a full scope of OB-GYN, but endometrial ablation, it's a procedure in gynecology that we do to treat patients that have heavy periods. And it's a minimally invasive procedure that if medications aren't working and your quality of life is really poor because you have heavy periods, this is a really quick and easy procedure that we take you over to the hospital for a same-day procedure. It takes all of about 2 or 3 minutes. And at the end, quality of life really improves because periods become very, very manageable. It's a procedure where you go to sleep for a few minutes and we introduce an instrument into the uterus. We turn on the machine. It lasts for about a minute or a minute and a half, and then it's done. You recover for about an hour in the outpatient setting, and you go home. And it really is very minimally invasive. There's no cuts involved and very, very little pain involved. So an ablation is a procedure where we kind of burn the lining of the endometrium, or the lining where the period comes from. And by doing that, we can drastically decrease the amount of bleeding that you have. By doing this procedure, we're kind of technically burning the lining of the uterus, the endometrium. This is where the period comes from once a month. And by doing that, it kind of thins out the lining of the uterus, and it leads to a drastically decreased menstrual flow. The recovery is amazingly quick. Very little pain. Some patients need some Motrin afterwards for a day. But as I said, there's no cuts involved, so it's a really, really quick recovery, and in a day or two you can be back to work. This is for people who are premenopausal, who can't take medication to control periods or don't want to take medication, and very highly effective because once the procedure is done, really there's no other treatment that's needed. I believe that not enough women know about this procedure. Patients tend to get a little worried when they hear surgery. But again, I try to reassure patients that this is very minimally invasive. You're going to go home feeling fine, and it's really going to be a life-changing procedure.